I think having a deeper understanding of issues that typically get glazed over as either normal parts of aging or unrelated to one another helps you get the kind of care you deserve now and build an abnormal future for yourself. One where you don't have to stop living before you die if you don't want to. The link between thyroid function and sex hormone changes at the time of perimenopause is one of those overlooked and brushed aside connections. Having a better understanding of how they're interrelated can prepare you to stand up for yourself and ensure that you're one of the few women who get elite level hormone care. You're listening to the Health Courage Collective podcast, episode 245. Does perimenopause affect your thyroid? Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hello. How are you today? I hope you are doing great. How are your good plans? Did you get them to finally start working for you by making those plans for a human and not a robot? It's not only way more effective, but it feels better too, to not expect yourself to be an emotionless, distractionless automaton. And you wouldn't want to be, even if it made you more efficient. So today we're going to talk about something that needs to be working optimally well for you to feel good. As you are trying to decide the best course of action for you to optimize your sex hormones for longevity and also to feel good now, you might be experiencing aches and pains, trouble concentrating, brief memory lapses, decreased libido, low mood, mood swings, constipation, thinning hair, dry, itchy skin, trouble sleeping, fatigue, weight gain, and/or irregular periods. And as you're disentangling what each of those means about your estradiol, estriol, estrone, progesterone, testosterone, pregnenolone, and DHEA levels and how to optimize those, there's another hormone to keep in mind that can be affecting all of those things that I just mentioned. Do you know what it is? I probably gave it away with the title of this episode, huh? Yes, it's your thyroid. A question I get asked fairly frequently is, why do women tend to start having thyroid problems around the same time as menopause? So I thought it might be helpful both for you to be on the lookout for signs that you might need some thyroid help, which can drastically improve your quality of life if you do need it, and to get a quick overview of why and how that might be related to your changing sex hormones. Life is much more enjoyable when all of your hormones, including your non-sex hormones like thyroid, insulin, cortisol, growth hormone, vasopressin, oxytocin, and more, are doing their jobs and working together, each in their own optimal range. But they can't each individually be optimal if their other hormone friends are not. They're all interrelated and they need to play nice with one another. I'm sure you don't need me to tell you that you can have either hyperthyroid or hypothyroid problems, too much or too little thyroid hormone. I don't think we need to get into all that, but either one can happen to anyone, male or female, at any time of life. But low thyroid, hypothyroidism, is much more common. It can be caused by iodine deficiency, which is rare in industrialized countries that iodize their salts like we do. There are some rare diseases and medications that can cause low thyroid levels. Rarely there can be a non-autoimmune case of thyroiditis or inflammation of the thyroid gland. But the most common reason for low thyroid levels is autoimmune thyroiditis or Hashimoto's thyroiditis. This is when your immune cells destroy your thyroid tissue. Even though thyroid problems are possible in anyone at any time, women are about 8 times more likely to have hypothyroidism than men. And the 45 to 64-year-old age group is the age group with the highest prevalence 13.1% of all people that age, but it's 16 to 21% in women over age 65. People over age 75 are more likely to have trickier subacute hypothyroidism issues. Interestingly, a few studies show that from 2009 to 2012, the overall U.S. prevalence of hypothyroidism increased from 10 to 11.7% overall, and from 2004 to 2018, the rate among just women increased from 1.6 to 3.7 women per 1,000 person years. So that's more than double. That's a big change since 2004. I have some theories about why that's happening, but nobody seems too concerned that it is happening. The typical thing that's explained by medical people is that since hypothyroidism is more common in women, and since hypothyroidism gets more common as you get older, that's why it coincidentally starts in many women around the time of menopause. So that's the official answer. I don't think it's coincidental, but I don't have any studies to validate my personal opinion about that. Most medical people say that we don't really know why hypothyroidism increases with age, but it might have to do with age-related changes to the immune system. In her book, What You Must Know About Thyroid Disorders and What to Do About Them, Dr. Pamela Wharton-Smith says that 90% of people produce antibodies that attack thyroid tissue. I'm not sure where she got those numbers, but that is what she says. So it makes sense that over time, even if you only have a few of those antibodies at any one time, the destruction accumulates and you eventually tip over the edge into hypothyroidism. There can be other things at play, like a shift in pituitary hormone set points and chronic low-grade inflammation that can hinder production from the thyroid gland. And we know that women in perimenopause have much higher rates of chronic low-grade inflammation. The risk of all autoimmune diseases goes up when you have increased intestinal permeability or leaky gut. So that's a big thing to consider if you have any autoimmune condition, including Hashimoto's thyroiditis. There are resources that can help you tackle that big project. Let me know if you need some help getting pointed in the right direction. Another thing to consider that is way beyond the scope of this episode is that about 80% of people who have been diagnosed with low thyroid are treated with just levothyroxine. That's the generic for Synthroid. That's T4, the inactive form of thyroid hormone. The idea is that your body knows how to convert it to T3, the active form that you need. But that is very often problematic, as are the tests that are done, or rather not done, for thyroid function. If you feel like your problems could be thyroid related and all your doctor does is test your TSH, that is not good enough. And levothyroxine alone as a treatment is also probably not good enough. Could be, but most likely not. Do your research and don't settle for the standard of care. Progesterone and estrogens, because there are several, and testosterone are all anti-inflammatory. Our bodies are used to having certain levels of all of these fluctuating around in monthly cycles in our bodies. So when those hormone levels decline, however naturally, our inflammation levels go up. Increased inflammation has been repeatedly measured in perimenopausal women. Increased inflammation can affect functioning of the thyroid gland directly, and it does activate the immune system, increasing your chance of making more antibodies to thyroid tissue and other tissues. So all autoimmune conditions can get worse with decreased sex hormone levels, particularly thyroid conditions, because we see more creation of thyroid antibodies with low estrogen levels. Estrogen also affects the rate at which we convert inactive thyroid hormone T4 to active thyroid hormone T3. So when our estrogen levels go down, our amount of circulating active thyroid hormone goes down. This matters to women who are already taking levothyroxine too, because once their estrogen decreases, they won't convert that to the T3 that they can use as easily. Another reason why just testing TSH and just taking levothyroxine isn't good enough. You need to know how well you can convert that inactive T4 to active T3. The presence of adequate amounts of testosterone also really helps T4 convert to T3 appropriately. Another way estrogen and progesterone are related to how well our thyroid is able to do its job for us is that estrogen and progesterone affect a glycoprotein manufactured in the liver called thyroid binding globulin. It's the carrier of T3 and T4 in the bloodstream. If you remember hearing about cholesterol boats in episode 171, What Smart Women Know About Cholesterol, thyroid binding globulin is kind of like the thyroid hormone boat. Decreased estrogen levels can decrease production of thyroid binding globulin in the liver, which can reduce the amount of T3 and T4 that can get transported through your bloodstream, but potentially increase free levels of T3 and T4 because they can't be in the boats. They have to be loose. When they're not in their carrier protein boat, they're free to be used up, which could cause periodic symptoms of high thyroid levels like transient heat intolerance and mood changes. Sound familiar? But the hormones will also get burned through more quickly than they should that way, and it could confuse blood tests. High estrogen levels, as can sometimes happen intermittently in perimenopause, increase thyroid binding globulin, having the opposite effect, and can also increase the risk that T4, the inactive form, will be converted to reverse T3 instead of actual T3. Reverse T3 blocks active thyroid hormone from binding to receptors. Reverse T3 is also made more when there's chronic inflammation and chronic stress. Also, estrogen stimulates the thyroid to make the thyroid hormone precursor thyroglobulin. Too little estrogen means too little thyroid hormone precursor is made. Too much estrogen could cause an enlarged thyroid gland from too much thyroglobulin. Can you see how messy this can be when your hormone levels, especially your estrogen, are going up and down kind of wildly at the time of perimenopause? If you're being treated for hypothyroidism with thyroid hormones and you have low sex hormones for a while, and then you start replacing them through hormone replacement therapy, your thyroid doses will probably also need to be adjusted because the sex hormones can affect your thyroid hormone levels. Usually you'll need a higher thyroid hormone dose once you add sex hormones back to your body if you've been deficient for a while. It will all depend on how low your sex hormone levels were, how high your hormone replacement therapy doses are, and whether you're doing just estrogen, which you never should be, estrogen plus progesterone, or estrogen, progesterone, and testosterone, and whether it's oral or a topical patch or a cream or vaginal or what. Not only is the menopause thyroid symptom disentanglement difficult because the symptoms overlap so much, and the time of life that they appear is very often exactly the same, but there's something more important than feeling good right now, which is extremely important. You need to feel good right now. I know I talk about this all the time, but it's because I don't want you to forget. Decreased estrogen, progesterone, and testosterone levels put you at a hugely increased risk for all of the major things that are going to make you stop living before you die. Increased risk of cardiovascular diseases like heart attack and stroke, increased risk of muscle loss and weakness, frailty, a pretty much guaranteed loss of bone strength, bone tensile strength, and bone mineral density, increased resistance to insulin, meaning poorer metabolic health, which increases your risk of all of the other diseases, increased risk of depression, anxiety, and other mental health challenges, and a much, much higher risk of dementia. So we know all this. I talk about it a lot because it's so important to remember. But did you know that hypothyroidism, or low thyroid function, also causes and contributes to cardiovascular disease, muscle loss, osteoporosis, insulin resistance, depression, and dementia? It does. So dragging through life with no energy because both your thyroid hormones and your sex hormone levels are too low is not only no way to live right now, but it will pretty much guarantee that your life will not be what you want it to be in the future. Hyperthyroidism, or too much thyroid hormone, either as Graves' disease or because you're taking too much thyroid medication, also comes with a long list of long-term problems. So you've got to get the dose just right. Your thyroid functioning is closely connected to the relative levels of all of your other hormones, sex hormones and otherwise. Estrogen, progesterone, and testosterone all influence your thyroid levels and thyroid gland functioning. But so too do insulin, cortisol, and leptin. Maybe even more so. If you're having thyroid issues, there's a good chance it could originate from the cortisol hormone coming from your adrenal glands, how much insulin hormone you're pumping out of your pancreas, or how much leptin is being secreted by your fat cells. Leptin is the satiety hormone telling you you're full and you can stop eating. High leptin levels, which can happen when we become leptin resistant because we have a lot of fat cells telling us to stop eating, but our brain can't get the message, causes conversion of inactive T4 to reverse T3, blocking active thyroid hormone from being able to bind to receptors and do its job. And of course, if you've got autoimmunity stemming from leaky gut, taking care of the leaky gut is the best way to get your own body to stop attacking itself. Easier said than done, but so worth it. There's a lot you can do for all autoimmune diseases by getting serious about building a super intelligent gut wall. With all of the overlapping symptoms of trouble sleeping, mood swings, fatigue, depression, memory lapses, decreased libido, constipation, hair loss, dry hair, dry skin, weight gain, irregular periods, aches and pains, and more, it can be hard to figure out what is perimenopause or menopause and what is your thyroid. The only way to really tell is with testing of both your thyroid hormones and your sex hormones. And if the thyroid tests are off, then it's time to see if that might be related to leaky gut, high cortisol, high insulin, or high leptin levels. One quick and easy test that you can do yourself at home is to test your basal body temperature. People with hypothyroidism tend to run cold all the time. The kind of typical way to test it is to get a regular thermometer and put it in your armpit as soon as you wake up every morning for at least 3 consecutive days. Some people do it just under their tongue like a normal person too. If you're less than 97.8, it's possible you could have hypothyroidism. Conversely, if you're hot all the time or have hot flashes, that can mean you have hyperthyroidism or low estrogen or even low progesterone. This is tricky stuff. Obviously, the armpit thermometer test isn't something you're going to use to dictate your course of thyroid therapy, but it's a little clue that you could look at. If it's time to get your thyroid tested, don't settle for a doctor who's only going to test your TSH, because it's not enough. You need a TSH, a free T4, a free T3, and a reverse T3 test at the very least. Anti-TPO and anti-TG are good if you can get them, though those are often only tested after you already know that you have a thyroid problem. While the prevailing wisdom, if you can call it that, is still that thyroid problems and perimenopause just coincidentally happen to frequently happen at the same time, like listening to a lot of Saweetie and wearing long pointy nails that handicap your ability to do manual tasks in the world. But just like those two, I don't buy it. I think they're more related than we're led to believe. The fact that 80% of patients with hypothyroidism are women strongly suggests that our sex hormones have a lot to do with our thyroid function. There isn't any peer-reviewed evidence to suggest that keeping your sex hormone levels close to what they were in your 30s will prevent you from developing thyroid issues as you age, but I would not be surprised to find out that that was the case. I would be surprised to find out that someone actually studied that, but not that it was beneficial. I hope that knowing a little bit more about the interconnectedness of thyroid hormones and sex hormones helps you be more confident in asking for what you deserve to feel good now and to safeguard your strength and independence for the future. And to realize that if you're working through some issues, you're not alone, and your body is not like some old Mazda with several completely different critical systems breaking down simultaneously on its inevitable journey to the junkyard. Everything is interconnected, and a rising tide lifts all boats, as they say. Unlike the Mazda, fixing one thing helps fix another thing, and it all works together. Your best years are ahead of you. The world needs you at your best. Thank you so much for being here today. Next week, we're going to talk about training to not have to settle for an average brain as you age. Until then, be aware of the connection between thyroid function and your sex hormones, and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed